Hi, my name is Patricia Apsida Hardacre, and my PowerPoint presentation is entitled Flood Preparedness for Safety, Health and Wellbeing in Remote and Rural Indigenous and Non-Indigenous Communities in Queensland. Queensland has the largest Indigenous population in Australia, amounting to almost 300,000, and impacts on health are greatest in remote and rural Indigenous and non-Indigenous communities. The social and ecological disparities for this group include limited local availability of health, mental health, disability and home-based aged care services, reduced education and employment opportunities, low income, poor access routes and food safety, inadequate infrastructure with poor water and energy supply, poor digital service and inadequate housing. Queensland policies to respond to flood disaster preparedness are the Disaster Management Act of 2003. The Get Ready Queensland website contains information and links to alerts and warnings, disaster preparedness and what to do during and after a disaster. The Disaster Management website contains much the same information. Cape York and Torres Strait Regional Resilience Strategy identifies the disparities for these remote communities and outlines strategies and funding sources to resolve the social and ecological disparities. The First Nations Health Equity is a strategy document to achieve health equality for Aboriginal and Torres Strait Islander people across Queensland. The poster aligns with the following Sustainable Development Goals of the United Nations. SDG 3, Health and Wellbeing. The development of a flood disaster plan is mitigating an individual's health and safety risks, protective clothing for mosquito disease transmission, and protection if you need to enter floodwaters. Having an appropriate medical kit allows injuries and wounds to be treated immediately. SDG 1 is no poverty. Planning can reduce the loss of belongings and business and therefore financial hardship. SDG 8, decent work and economic growth. Planning can reduce loss and damage to housing, businesses and livestock. SDG 9, industry, innovation and infrastructure. Planning a high ground refuge provides safety. An effective communication system mitigates stress and provides ability to contact SES if needed. And lastly, SDG 15, Life on Land. Relocating livestock and farm equipment mitigates financial loss. Enablers to success in health and safety in a flood disaster are the SES, who assist communities to prepare, respond and recover from disasters. Get Ready Queensland website is the complete guide for preparing for and source information on a disaster. Australian Red Cross program, First Nations Recovery Group, teaches resilience to Indigenous communities and works with emergency and recovery services to lead disaster recovery in a culturally safe and appropriate manner. Queensland Government strategy of having all 77 councils, including Aboriginal Shire councils, develop a disaster management plan designed on their cultural and community needs, and then the Queensland Government inclusion of Indigenous and their cultural knowledge of the land in assessing and planning for disaster risk. Barriers to success in health and safety in a flood disaster are the Barco Shire Council has no weather radar and therefore cannot receive accurate weather information in central Queensland. Prior to the floods, outback infrastructure was in poor condition. Communication has been identified as a chronic issue during disasters in Australia, as well as no reception/mobile black spots throughout Australia. Insurance premiums based on disaster risk make insurance expensive and unattainable for lower socioeconomic groups. Queensland Government Indigenous website does not contain a tab for disaster management. Here is my poster with all the messages. Here are my references, and thank you for listening.